Thank you so much, Andrew, for that comprehensive overview. I will go ahead and share my screen. Perfect. So we've had a great overview covering, the analysis, Medicare. So now we're going to get into, going through the Medicare Plan Finder website and looking at the plans, doing the plan comparison, and going over some of the tips that Andrew has highlighted in the PowerPoint. So as you all know, in your training materials, we have this online protocol. I've taken screenshots. It's going to walk you through step by step. So you will have all of this on hand when you do your analysis as well. So don't fret. I'm going to try to go really slow just so everybody can see. I know a lot of people are familiar, but if this is your first time, just to get acclimated with the website and the online protocol document in your training materials also walks you through this step by step. So this is the main page. I bookmarked this particular site, the /plan compare, because if you just go to Medicare.gov, you can get here, but it's a number of clicks. So if you're doing a bunch of these, which we hope you are, which we appreciate your time, it can be a little bit more convenient just to start at this page so you're not clicking through the Medicare.gov site. So on this plan compare page, as Andrew mentioned, you have the opportunity to log in on the left if the client already has an account. You can create a My Medicare account. The person is new to Medicare, and but that is more of a rare situation these days. If the client has forgotten their My Medicare account information, then we'll do the general search. One tip that comes up often, if you are copying and pasting from saved My Medicare account information, extra spaces that can be left when you copy and paste information will cause, will give you a incorrect password or incorrect username response. So if you copy and paste and there's an extra space at the end, they will consider that a character. The website will consider that a character and it will return. So just make sure if it's coming back, there's an error, first check to make sure there's no stray spaces in the front or the back of the username or password. That can resolve the issue. If not, you can check with the client to see if a lot of times people have changed their password. Unfortunately, working with older client populations, there are some times where clients have changed it and forgot, or changed it and lost like the piece of paper that they wrote the password down on. So do not fret. I wouldn't spend a lot of time on it. We can always do the general search. The general search will allow you to have all of the same information. You will just need to be a little bit more careful with entering the client's public benefits or Medicare Savings Program information to make sure that you are getting the most accurate cost and coverage options based on that person's public benefits. So we are going to proceed with the generic search. The big difference, they are very similar. The personalized search is just a little bit faster because you'll have the client's saved drugs already. And in this case, you'll have to manually enter all of the drugs with the generic search. So as Andrew mentioned before, we are looking for 2024 plans, which is selected here. I'm going to use Whitman Walker Pharmacy Uptown zip code. And you will use zip code in your client's intake form. And we are always going to look for Medicare Drug Plan Part D. Now, as Andrew mentioned, we have a number, the Part C plans, the Advantage plans have been very aggressive with their advertising. And I think this year is the first time that over 50% of people are in Advantage plans. So if you do see this, you can check here to confirm the medication list is still accurate for the Part C plan, but we will be focusing for the most part on Part D plans. And the majority of our clients are in Medicare Part D plans. Okay, so the first screen, and we are able to confirm here, we are viewing 2024. So this is something to just check if you're clicking back and forth between screens, you are able to see here what year you are looking for. And you can always switch back to 2023, but should not need that in this case. Here is the list that Andrew was mentioning where you can select the person's Medicare Savings Program. If the person has QMB or QIMB, you would select Medicare Savings Program. It gives you a brief description as we talked about. It pays for the premiums, deductibles, co-insurance, co-pays, and reduces the drug costs. If a person is a dual, as we talked about, they have full Medicaid and QMB, then we would select Medicaid. And that will show us the unique pricing for someone who also has Medicaid. And then if the benefits, then we would select SSI because they also have a unique cost based on that coding. So you will have that information in your intake. And this breakdown, as Andrew mentioned, is both in the online protocol and in the presentation. So if you're not sure which one, you can always check with your mentor. But if it's only QMB, we select Medicare Savings. If it's QMB and Medicaid, Medicaid or SSI. So we're going to say this person, our hypothetical person here, is a dual. So they have QMB and Medicaid. So that means we're going to select Medicaid as their help with cost. And we will select next to proceed to search preferences. We always want to see the drug cost in this instance. We are comparing plan costs, so we will always select yes here. And now we get to the drug, adding the drug screen. So we're going to run through a couple of common drugs here just to highlight some things that you'll see in your process. So one thing to know, and we're going to start with metformin, which is a common drug for our clients. So on your intake form, on your list of drugs, a lot of times it will say, the drug name by itself, like metformin, or it will say metformin HCl, which is hydrochloride. So you would want from this list, and it'll always auto-populate a list of forms of that medication for you. As you see here, there is a metformin hydrochloride. So if anything is that drug name HCl, you want to find the hydrochloride option to make sure it's accurate. If it's HCTZ, that's hydrochlorothiazide, and that will also come in as a separate option. So these are different compounds of that medication. That's why it's really important to make sure you're entering that information, the name fully. And so we can add the drug, and then it's going to take us to the dosing information. So this information that comes up here is a common or standard dosing for this medication. A lot of clients will have the standard dosing. So that's a great place to start, but you want to make sure you're referring to your drug list for accuracy. This is very important when we get into quantity limits and other restrictions the plans might have. So we're going to say that the individual has this standard 1,000 milligram tablet, 60, which means 2 pills every day per month. As you can see here, there is a list of other forms of this medication. You will see the HCl-ER, which is extended release tablet. So if someone has metformin HCl-ER, you want to select this option because that extended release tablet is a different form of the medication than the non-extended release. And obviously an extended release would be typically a 24-hour. So it should only be 1 per day for most people. But that can depend on, each individual situation. So just an example of when you put the medication in, you put the entire name in, it's going to give you all the different options for that, that they have in the system for that medication. So we will stick with the standard 1,000 milligram tablets per day, 30 days. So we're going to add that to our drug list. Now we started our drug list and we'll add another drug. So the next drug we'll add is a common antiretroviral for those living with HIV, which is Biktarvy. And as you see, as I type it in, it's going to give me options. We have Biktarvy here. We're going to add to our drug list. And most of the antiretrovirals will have this 5225, some kind of compound, because they're a compound of a couple of antiretrovirals. There typically is only 1 or 2 versions of the antiretroviral. So you see there's only 2 options here in comparison to the metformin. And typically they're taken 1 per day. So that's pretty straightforward. And we will add to our drug list. So we'll do 2 more. The next one we'll try is vitamin B12. And as you see here, vitamin B12 does come up in the prescription drug list. But as we know, Andrew already discussed that there are excluded drugs, that Medicare excludes certain drugs from its formulary. You have that list as number 6 in your training materials of excluded drugs. And what we see the most of those excluded drugs are over the counter, so aspirin, low dose ibuprofen, like symptomatic cough suppressants, like cold and flu type medications, and vitamins. The other last one that I'll talk about is, and we'll discuss a little bit later, is erectile dysfunction or sexual health medications like Viagra, Cialis, also a lot of times seen as sildenafil, which can throw people off, which is the generic version of those. Those are largely not going to be covered. There are very few instances where there are folks that take those drugs that are coded as erectile dysfunction drugs for heart health issues. But in most cases, it's not going to be covered, and it's going to really mess up your plan analysis because it's going to drive the cost up. So that's something, if someone has sildenafil, Cialis, Viagra, you'll leave that off of your analysis to make sure you get an accurate comparison. So as you see, we put in vitamin B12. That's obviously a vitamin. It should not be covered, but it comes up in the Medicare formulary. A lot of other things, if it's like vitamin C, you won't have, some vitamins won't even come up. If you try to search it, there will be no option because it's just not covered. So in this situation, there is a vitamin B12 that comes up in the system, but you see there's only one type of vitamin B12, and that is a solution. So most likely your client has a tablet, certain number of vitamin B12 pills a month. This, however, is a vitamin B12 injection. As you can see, it comes in a vial, and it's a liquid. And so this can be administered for folks who need it by their doctor. So if the client has a vitamin B12 injection that they do with their doctor, that is very rare. That would be the only time typically a vitamin would be covered. So because we don't see our tablet as it would be listed in our drug list, we are going to cancel and not add this to our drug list. So again, but will not mess up our plan finder results. So the last thing we'll add is the client's inhaler. Now, as Andrew mentioned, Ventolin is the type of inhaler that is covered by most Medicare Part D plans. And as you see, when I typed it in, it gave us the option to choose the generic version albuterol. Now, this is you'll get this pop-up screen anytime you enter a brand name drug into the system. It's gonna offer you the chance to use the generic instead. Our standard would be to use the generic version for basically almost all drugs. There are a couple of exceptions, and the albuterol inhaler is the most common. The albuterol inhaler, for some reason, the generic is just not covered by the plans. It is more expensive. So the brand name we will choose in this one instance. So in this instance, we'll say keep brand, but for most other drugs, you will say add generic. So we're going to keep the brand name Ventolin. This is the standard dosing. You're going to want to make sure if it's albuterol, if it's Pro-Air, you want to make sure that you're checking the dosing every time to make sure it is accurate. There's only one type of dosing for the Ventolin. And then you have the 18 milligram inhaler option. So we're going to say one inhaler per month and then add to our drug list. So now we have our complete drug list here because the B12 we have removed, and we are ready to proceed with to add our pharmacy. So scroll to the bottom of the page. If you need to go back, if you forgot a drug, you can always add another drug here. And sometimes the client will say, oh yeah, I forgot I had this one. So you can always go back and add more drugs to your analysis. And then when you're done adding drugs, and we will move on to adding the pharmacy. So you can choose up to 5 pharmacies. I will start in this instance with Whitman Walker Pharmacy. And so we've entered 2009 as the client, 20009 has the client's zip code where they live. And when we type in the pharmacy name to save time, we have our 14th Street location pop up so we can add that pharmacy. And you will see that that pharmacy has been added at the bottom of the page here. So we're also going to say that this client has a second pharmacy, and some clients have multiple pharmacies for various reasons. Oftentimes I hear of clients that say I like to pick up my HIV or other discretionary medication at a pharmacy that's not in my neighborhood, where I'm not going to run into my neighbors or coworkers or something like that. So it's important to capture all of the pharmacies listed, because clients might pick up different medications at different pharmacies for a variety of reasons. So we're going to add Alpha People, which is a specialty pharmacy in our right around the corner from our 1525 location on 14th Street. And we'll see it has populated here. And we can add this pharmacy as well. And you see we have them both now listed at the bottom. You can add up to 5 to your analysis. If you type the name in and you're not seeing it, you can also change the distance up to 25 miles. That allows you to not have to go back and search, and should hopefully pull up the location. And we are ready to proceed. So we'll click done here in the corner once we've selected our 2 pharmacies. And now we will be taken to the plan results. And so, as Andrew mentioned, and most of our clients will have LIS. They will have 0 premium plans, and their cost generally should be fairly low. The one LIS plan from last year that is discontinued is Humana Basic. So Humana Basic will be, I believe it's $3.10 for the premium. Ideally, we would want to get someone out of Humana Basic and into one of the 4 LIS plans, so they are not having to pay a monthly premium. I know it's $3 a month, and obviously this is a client choice. I recommend it because clients who have LIS typically are just not used to paying anything for the premium. So if they stay in Humana Basic, that means next year they're going to get a bill, and it's going to be for like $9.30. It'll be billed for the quarter, and a lot of times people don't open it, or they think it's junk, or they forget to pay it, and then they can create issues with their premium. So ideally, if someone has LIS, we're getting them out of the Humana Basic. If they love Humana Basic, if they had it for 20 years and they don't want to change and they'll pay the invoice, that's fine. If they want to keep it, it's totally up to them. As we said, it's their choice. But I would explain to them, you're going to have the invoice, it's going to come, you're going to have to pay it. It's money that you could save, but if you really like it, you can stay in it if it still covers your drugs. So the 4 LIS plans for this year are SilverScript Choice, WellCare Classic, Cigna Secure, and ClearSpring Health Value. As you can see, we have a plan that's not LIS that comes up second on this list. It has a monthly premium, and that is because this page is sorted by lowest drug and premium cost, which is our standard plan sort that we want to use to make sure we're capturing that LIS pricing. Of course, even though the total is $100 for this plan with a monthly premium, and this is $101 per year, we still would want to get the client in the LIS plan, ClearSpring Health Value, that does not have a monthly premium. So be mindful when you see the monthly premium here, you're always going to want to go for the 4 0 premium plans if the client has LIS. And so if you have the personalized search open, there will be noted the first time that comes up is the client's existing plan. So if for this example, if the person had SilverScript Choice this year, it would say your next plan, and it would say SilverScript Choice. It would be highlighted in green to say, this is what you're going to have for 2024. Below that, you would then scroll to see, are there any plans that are cheaper? Now, when we say cheaper, I'm going to go back to what Andrew said. Changing, so if the client's in ClearSpring Health Value next year, and it's going to be estimated $101 of cost, and SilverScript Choice is available at $74, that's not enough money that we would suggest of savings that we would suggest the client switch plans. As Andrew mentioned, it is really challenging for folks to change their plans. That means they have to wait for a new card in the mail. That means they have to tell all their pharmacists about their new plan details. It can be a lot of upheaval for folks. So a $25, $30, although that is an important amount of money for our clients, typically we're not going to suggest a change unless something is not covered, unless their pharmacy is out of network. And you can typically tell that something is not covered or the pharmacy is out of network because this cost will be in the tens of thousands of dollars. So it's very noticeable when something is not covered. So let's look at SilverScript Choice because it's coming up as our cheapest option at $74. So we'll click the plan details. And all of the things, all of the pricing, pharmacy information, all of your information is going to be in these plan details. So we're going to need to, the mentors are going to need to receive the plan details of the current plan. And you can use this print option, print to PDF. But we definitely need to see the plan details for the current plan. Most people will not be switching plans, which is great. So we'll just need that. But if you recommend that the person switches plans, then we'll also need you to print the PDF of the recommended plan so that we can review both of these. So we can see here at the beginning, it says covers 3 of 3 drugs. So we know already all drugs are covered, no monthly premium. It's looking good. Showing no drug deductible, as we talked about with LIS plans. And we see here, both of these pharmacies are in network. Now, sometimes a pharmacy will also say preferred in network with a marker here. A preferred in network pharmacy oftentimes means that clients will receive $0 copays for simple medications, commonly prescribed low-cost medications. So there can be benefits to a preferred in network when a plan is preferred in network for the person's preferred pharmacy. As we see here, the prices are fairly comparable. And when we're looking at the copay costs, it's just a reminder that these costs are estimates. So this is in Medicare's estimate of what this pharmacy is going to charge. I've heard of a number of clients who have gone to a pharmacy like Alpha People's for years, and they say, oh, they don't even charge me that amount. They charge me less than that. Or, you know, some other variety. Oh, the pharmacy offers a deal on this or that. So this is an estimate. We go off the estimate, but this is another reason why if it's $25 difference, that's not a reason, $50 difference to switch the plan, because the client might not actually experience that exact saving at the pharmacy due to the estimation of the copay cost. So we have the total annual estimate here. We have the estimate for each drug breakdown. So you have all of the details. And here is a month-by-month breakdown. So I think this breakdown is really helpful for clients to see this is what my estimated total copay cost if I fill all medications per month. So I can expect in January, it's going to be the highest. And then as I hit catastrophic coverage, you see in May, if the client fills all of their medications, they'll hit catastrophic in May, and they will have no copays for the rest of the year. This often happens with clients who have antiretroviral drugs for their HIV or other types of specialty drugs that are really high market value. They'll hit that $8,000 mark a lot earlier than others. Now, another point that I will go back to, just scroll up here with the Biktarvy. So we see the annual estimate of the Biktarvy. For a client that is living with HIV, if they're under 500% of the poverty level, they're eligible for the AIDS drug assistance programs in the area, also called ADAP. And ADAP will pay the copay costs in these first couple of months. So all of these copay costs in here, that is Biktarvy, ADAP will pay that copay. Now, it's really important to distinguish that ADAP will pay the copay of a covered drug. So if the person's Part D plan pays for the Biktarvy, the copay cost that is left over, ADAP will then cover that copay. And there are a number of drugs on the ADAP formulary. There's like antibiotics, there's a number of drugs, and those formularies are also in your materials, so you have them as a reference point. But if you're seeing, you know, the client has LIS, but they have like 15 drugs and it's a lot of copay costs, ADAP, if they are actively enrolled January 1, will cover the copays for anything on the ADAP formulary, as long as it is also covered by their Part D plan. If the Part D plan is not covering the drug, ADAP will not then cover the full market cost of that drug. They're only covering the copay. If someone in the scenario that Andrew mentioned earlier, where they are not eligible for LIS, but they are living with HIV and they're eligible for ADAP, ADAP can also pay their Part D monthly premium. So they will need to send that invoice of their Part D monthly premium of their non-LIS plan to ADAP. ADAP will pay that, and ADAP will then also pay the copay. So it's another great program to assist with those copay costs. Most folks with ARVs are going to hit catastrophic, so they're not going to have copays in the latter part of the year, but that calculation renews each year. So people are always going to have, and I think they're always surprised by their copays in January because they're like, I haven't paid copays for 8 months. What are you talking about? But every year that calculation restarts of catastrophic coverage, so they will in January. So it's important if folks are ADAP eligible that they are getting enrolled and they have that copay assistance in the beginning of the year. Okay, as we scroll down the plan here, we have the option to have the breakdown for each pharmacy, which is great. And you'll see retail costs. This is why we get to 8,000 very quickly. And we have, the cost before deductible, after deductible. For those with LIS, we're not going to have a deductible, so we're not as concerned. And then if we select view more drug coverage at the bottom, this is telling you, general plan percentages, but what we're really here for is this section, other drug information. So this is where we're going to see where the drug restrictions are. So as you're going through the plan analysis, you want to click through, open all these boxes to review, and make sure that you are looking, we are verifying for the plans this section. As we talked about, prior authorizations, quantity limits, and step therapy are the main restrictions. If a plan has step therapy for a medication, we probably don't want to select it if there are other plans available that maybe have just the prior authorization. Prior authorizations are somewhat common, and the client would reach out to their medical provider to complete the Part D plans form to request a prior authorization for the drug because it's medically necessary. If a client is in an existing plan with a prior authorization and they've been in it for years, most likely that's already been done with the plan and doesn't need to be done again. But if the client is switching to a new plan and has a prior authorization, their doctor will likely have to do that in the new year with the new plan. So the formulary or the prior authorization is requested based on the plan, not based on the year. So if they're already in the plan, they should be good, but if they're switching to a plan with a prior authorization, they need to reach out to their provider to complete that. In terms of quantity limits, this is another really important. If someone takes 1 pill a day, they're going to be within the quantity limits. That's somebody we don't have to worry about. You're really going to be concerned when somebody takes 3 or 4 pills a day, or needs multiple lotions or multiple vials of drops. And so when you can find your quantity limits of the plan here, you'll click the yes button. So this tells us Biktarvy does not have quantity limits, and that is because it is 1 pill a day. That is the prescription for it, so it's not going over. And then we see here, we do have quantity limits for the metformin and the inhaler. So when we click yes here, we see that the client can have up to 75 of these 1,000 milligram tablets per month. And we can see here that our client has 60. Sorry, our client has 60, so we are within those quantity limits. And for the inhaler, the client can have 36 inhalers within 30 days. So obviously with our 1 inhaler, we are within the quantity limits. So in this case, we're all set within the quantity limits, no step therapy, and no prior authorization. If you are comparing plans with comparable costs, we would want the plan that has the least amount of restrictions as sort of a tiebreaker. If there's step therapy, we want to avoid that at all costs if possible. And again, we have the star ratings here. It's not a reason to switch plans, as Andrew mentioned, but if it's 2 LAS plans and they're exactly the same and you're like, what should I pick? Maybe the star rating is a good tiebreaker, but that would be the only reason for that. And another option, so another point that Andrew brought up is if the client has an excluded drug and no plans cover that drug. That often happens with like new drugs or specialty versions of a drug that have recently come out. And a lot of times those drug manufacturers will have patient assistance programs where they will offer people a certain amount of money, or they'll cover that medication for the person for the first year or however many years because it's new and they know people are not covering it. And that allows folks to try new medications. there's also the opportunity for a formulary exception. So if someone absolutely has to take a medication and nobody covers it, their provider can try to request from the plan a formulary exception. And again, this is all information to talk about with your mentor, but it basically there are a number of options for folks in these instances. And I can stop sharing my screen, but the last thing I'll add is if you do find a better plan and you talk with your mentor, they review both the current plan details and the recommended plan details, they advise that you switch, you call the client, you get their consent to enroll. When you do the enrollment at the bottom of the page, then you will need to print the enrollment confirmation page. And that's absolutely critical and vital that we have that enrollment confirmation page printed to PDF, because it has their confirmation number if something goes wrong with the application or it's not processed properly. It also has the plan number for the client to call if they do not receive their new Part D card in the mail. And it's also our proof, obviously, that you were able to complete the enrollment. So very important. We need the plan details printed. We need the enrollment confirmation printed. If the client stays in the same plan, just the plan details, nothing else needs to happen on the website. The client doesn't need to do anything else. They're good to go for the next year.